Okay, let's talk about something today that I see a lot in the clinic, but I don't hear about much talked about among practitioners, or I don't see it much in the education process, for example. But when you hear it, you'll probably think to yourself, "No, I see that all the time." But to put a name to it might be helpful here. So let's think about it this way: you have chi stagnation that is in the lower jiao, right? And the typical symptoms being like gynecological symptoms. Then you get like, okay, what we would call liver qi stagnation and entering the spleen or affecting the middle jiao. And this is typical, more like digestive symptoms, right? Stress induced digestive symptoms. But one thing that we don't spend much time thinking about is liver qi stagnation entering the upper jiao, or what we could think of as just qi stagnation of the chest or qi stagnation of the upper jiao. It's just not something that you hear talked about very much. But for me, it's amazing because I see it all the time in the clinic. And the main symptom for this is almost always anxiety. Okay? So let me run through the symptoms a little bit, and then let me expand on it a bit. So things like, of course, anxiety, but anxiety when it's paired with chest tightness, or let's say difficulty getting a full breath, inability to get a full breath, right? So that difficulty breathing in, palpitations, right? The sensation of the heart beating in the chest, that uncomfortable sensation, but even things like chest pain, or what you could think of as like kind of heart pain, this very kind of gripping, sort of painful sensation that a lot of anxiety patients will describe, right? So when I see anxiety paired with chest tightness, difficulty getting a full breath, palpitations, chest pain, centered heart pain, that tells me that very likely there's what I think of as qi stagnation of the chest. And it's compressing the lungs, and so you have the sensation of chest tightness. It's compressing the lungs, so you get difficulty expanding the lungs to get a full breath. But then you get the palpitations, the chest pain, the heart pain. This is all the qi stagnation compressing the heart as well. Okay? I think when I see this the most is the combination of liver qi stagnation added to kidney and liver yin deficiency. So what you get is this heat rising into the heart, and that'll be kind of more the source of the anxiety probably. And then you add on top of that the qi stagnation, which just makes it worse. And then it adds those other symptoms on top of that, right? So it's this combination. Like I said, I see this most, I think, in a deficiency heat. So, typical symptoms there, right? Sleep stuff. It's typical, just difficulty staying asleep, running hot at night, sweating at night, restless leg, dreaming, dream disturbed sleep, as we say, all of these things. When I see anxiety paired with chest tightness, paired with sleep issues, then this is the diagnosis: qi stagnation of the chest, plus deficiency heat rising into the chest, right? So this combo here. Okay. So what do we do? So the second piece to this is not just the symptoms, of course, it's palpation, right? So typical palpatory areas, a very typical treatment here is the kind of classic liver 14, lung 1. It's sort of the exit point of where liver 14, where the qi travels from the liver and starts the circuit over again at lung 1 there, and there's that gap between liver 14 and lung 1, so to speak. And if there's qi stagnation, then there will be blockage at both ends of this connection. And so liver 14 will be tender, and lung 1 will likely be tender. Okay? So on palpation, those 2 points quite often tender. Okay? I like spleen 21 here. Very often quite tender, and I think it's just that qi stagnation getting into the channel. It's not something necessarily specific to spleen and stomach, like qi deficiency or not so much that. I think it's more related to its location on the chest. This could be a conversation for another time, but I often have the notion or feel like spleen 21 is in some ways a gallbladder point in some sense. But the point being that maybe just by proximity, This stagnation causes that point, this very chi active point, to be tender. Ren 17 will be tender on palpation, indicating that heat getting trapped in the heart. That's what's driving that anxiety. Other points that are often tender in this situation: heart 3 on the elbow there. Often a point for yin deficiency affecting the heart, so the heat shows in the channels there. That being another conversation we can have later. Kidney 27 is often tender here. Again, I think proximity, a very chi active point, so a typical area to get stagnation and for heat to gather in that case. Okay, so these are all generally local points that are going to be tender, and the reason they're tender is because of the chi stagnation and the trapped heat. But then you also get tenderness along, for example, the lung channel, especially lung 6, and then as it moves, you can kind of palpate starting around lung 6 and then start moving your thumb towards lung 5 and just kind of palpating along that part of the channel, sort of the more proximal end of the channel there, moving up towards the elbow. And the notion there being that the chi stagnation is actually affecting not only the lung organ, showing that chest tightness, difficulty getting a full breath, but also the lung channel, and so that stagnation starts to show. But that stagnation showing in the lung channel could, in theory, spill out to the large intestine channel. So I like to test the large intestine channel, sort of maybe start at LI11 and then go distal, just look for a few spots there. But also possible in this situation is the heart and pericardium points, the small intestine channel even. So these are all possible, and you're generally looking for sort of tender points. That's the first thing I'm looking for. But barring that, maybe just some really tight areas would be good. And then what you do, of course, is you needle them. So when I'm palpating these points on the arm, I like to have my needles ready. So I have a needle ready in my right hand, and then I'm palpating with the left hand. And if I find a spot where the patient says, "Ooh, that's tender," then I'll needle it right away, so I don't lose it, so to speak. So, okay, we've got a bunch of points you can palpate that are just confirmatory to your diagnosis. So you're thinking to yourself, oh, I have all the symptoms here of chi stagnation of the chest coupled with yin deficiency, heat rising into the chest. And then you want that confirmation through palpation showing, mostly in the local areas and in the related channels, showing that heat and stagnation is present. All of those points that I mentioned are game for treatment as well. So typical is, very often, is as I'm palpating, I'm needling them. So if they're tender, then I just start needling them. Also because the exact location of the point isn't always, the same every time, all the time in every patient, right? So if I find the point, I don't want to just touch a bunch of points that are tender and then go back and needle them. I want to needle the spot where I found the tender spot, right? To open that channel, to release that heat, relieve that heat. Okay. So a lot of these are either local points, distal points in the related channels. But other points that I might think about here, a classic treatment for this, a classic treatment in TCM might be something like, liver 3, large intestine 4. I'm not as concerned about what you're interested in about a distal treatment here. What kind of points you want to choose on the hands, on the feet. You can pick the points that you're interested in. I think the important thing here, the most important treatment here really is that local treatment and then the channel palpation. Those are the two really most important things. And then everything else around that can be structured around how you already think about acupuncture and the points you like to use. That's fine with me. I don't have a problem with that. The points that I would use in this situation come from my training, so it's going to be points like liver 4. Right, it's the metal point on the liver channel, so it has that relationship there. And very often you'll find in these situations that point is tender, right? And in this case, the liver 4 just treats the chi stagnation aspect of it. It doesn't treat the yin deficiency. So you'll have to find other points to treat the yin deficiency. Typical is liver 8, which in these cases is typically quite tender. Another point that I like here for the chi stagnation symptoms is kidney 7. And this is often given as a point. It's another metal point. It helps push chi to the lungs. and makes the lungs stronger. Because remember, the lungs regulate the liver. It's the metal that chops the wood, right? So when there's too much wood, you can strengthen metal to regulate the liver. Well, in this case, the lung is the organ affected. So something like kidney 7, where you're supporting the lung's ability to spread the qi, the lung's ability to push through stagnations, kidney 7 supports the lung's ability to push through those stagnations. That's the same really as kidney 27. That's the point of using that point. Kidney 27 then also draws that kidney qi up to the lungs and strengthens the lung's ability to spread that qi, not just through the channels, but in this case, specifically out of the organ, out of the lung organ, right? Okay. I already mentioned this, but lung 6-ish, depending on where you find a point. Another really good local point that I like for this is gallbladder 21. We often say the gallbladder 21 has a relaxing effect on all 3 jiaos, lower, middle, and upper. Yeah, that's why we don't use gallbladder 21 in the early parts of pregnancy, because it can have a tendency to relax the qi too much, right? When you need that stagnation in there to hold the baby up and in, you don't want to relax that qi too much. So we avoid that point when it's unnecessary in these situations. But in this case, quite useful because it does have a very specific effect on the chest. It's a kind of a local point. I use it a lot in asthma and the like. So these are very, very standard points to use. These aren't the only points that you can use. There, like I said, any number of points that you want to use, it's fine with me. Auricular, scalp, anything that affects the lungs, affects the liver, affects the heart, however you want to structure your treatment. I think what's important here is the concept, the idea that there is such a thing as qi stagnation of the chest. And the second thing that's really important here is the local treatment, right? That's the beauty of acupuncture, is you can treat locally. And it's good. My results around this are quite, I'm very happy with them generally. The patient really feels the difference, Now, of course, the continuing to resolve that qi stagnation and then continuing to supplement the yin. So these are the 2 long-term challenges here. So what else? Back shu points, of course, standard, nothing surprising there. Herbally, what's interesting here is we don't really have a sort of a standard TCM formula that we think about for qi stagnation of the chest, right? You have things, for the middle and lower jiao, pretty typical, but we don't really think about this, and what's typical is when you see in the books talking about patterns like qi stagnation affecting the heart, it's usually just regular qi stagnation formulas like Shaya-san or Jiaowei Shaya-san or something like that. And those actually do tend to work quite well, possibly needing some modification for yin deficiency in that. But they can often work quite well. But it would be nice if there was something a little more bespoke, something a little more. There are a couple of formulas that you see used in these situations, and mostly herbs or mostly formulas that are not typical around this, but that I've seen used for this. For example, something like Bansha Hopotang. Bansha Hopotang, we're usually using that for sort of excess phlegm in the chest, and then clearing that phlegm out of the lungs and stopping cough and that kind of thing. But what's interesting about Bansha Hopotang in this situation is that the Hopo and the Zutsuye are both aromatic. And it's that aromatic nature of those herbs that helps to move the qi of the chest, like a local qi movement, right? They don't enter the liver. They don't affect the liver in the way that we think of in TCM. They don't affect sort of quote unquote liver qi stagnation, but their aromatic nature does help to move the qi specifically of the chest. And then this often can be enough to clear some of the symptoms. In fact, what I often do is I'll have people carry around a little bit of Bansha Hopotang, and if they start to feel almost what I think of as like the early symptoms of their anxiety coming on, the little bit of chest tightness coming on, a little bit of that difficulty getting a full breath, they can actually take a couple of doses of Bansha Hopotang, and often that's enough to kind of head it off, just to get that stress off the chest. like I said, it's not really treating the source of the stress, but it's treating the main symptom to some degree. So it's symptomatically useful. I don't really use it in the long term. A bit drying, and it doesn't, like I said, it doesn't really go to the source of the thing, more as an acute sort of symptomatic thing. Something that I would use a little more long term, although it can be used acutely, but this is a more middle range, not a long term formula, but like a middle range term formula would be something like Sunisan. And Sunisan does famously regulate the liver and all that, but it does contain Jershire. And Jershire has also an aromatic function on regulating the lungs and the chest, and it does treat chest issues, that herb by itself, and so can be quite useful here as well for both regulating the liver and then also symptomatically regulating the chest. So I like that. That can be a useful formula in the more medium term. Like I said, something like Shayasan can work fine. But then you need to think ahead, at least, at some point you need to start thinking about if there's that underlying yin deficiency, you need to think about that. Now, yin deficiency is not the only kind of heat that can happen here. Of course, you can get excess type heat. Right, so not just deficiency heat, but excess type heat, and this is more of a, this is liver excess. This is true liver qi stagnation, but sleep is fine. More, this would be like trouble falling asleep rather than trouble staying asleep would be more typical here. So, just ye be warned. But anyways, this is something that I see a lot in my clinic. It's a very common, very, very common presentation. So if you're seeing it in your clinic, let me know. I would be very interested to hear your experiences. There's a lot more to say on this, but good enough for today. All right, take it easy, guys.